On November 11, lawyers will present Coroner Caitlin English with their oral submissions, and she will then take up to 6 months to make her recommendations in this case. Now, George, I want to bring you in on this. Why has it taken so long for the courts to acknowledge systemic racism as a contributing factor in deaths in custody?
Well, essentially, I think there's no reason to expect that, just like policing or healthcare, that discrimination and bias don't find their way into the justice system. I mean, it's a colonial system, and it's taken 230 or so years to get to a point where we're actually finding there are some judges and some coroners who are prepared to acknowledge that bias, systemic bias and racism does exist in the system. There are plenty who don't. Different states have different policies and different court systems, and you can still find courts around this country that will refuse to address the issue of racism.
Is it a small victory for Aboriginal and Torres Strait Islander people who've been saying it's existed for such a long time? I mean, we heard there 30 years from the recommendation from the Royal Commission
to abolish public drunkenness.
30 years.
Yeah, and many of the recommendations of the Royal Commission into Aboriginal deaths in custody have still not been implemented, and if they had, lives would be saved. So it's a travesty that these recommendations have not been implemented and lives have been lost as a result.
Yeah, George, I want to talk about Naomi Williams. Now, you worked on the inquest into the death of Naomi Williams, who died after being discharged from Tumut Hospital with just 2 Panadol. It's a shocking outcome. Do you think justice can be achieved for the families through the coroner's court or coronial inquests?
It's a really good question. I think the justice system has let Aboriginal people down at every stage. So why should we expect coroners to do any better? But we have seen a change more recently. In the Day case, I've got hope because you've seen law reform come into being. 30 years after it was recommended, you see law reform. In the Williams case, you have a coroner identifying systemic racism and making very strong recommendations about how the health system can address it. And I think that there is hope. You're seeing a cohort of Aboriginal doctors and nurses and midwives and health workers come through the system. There's change coming, and I do believe that in the future we will see a lot of these recommendations implemented.
So from the Naomi Williams case in particular, you do believe that systemic change will come from the recommendations?
If they're followed up, and Naomi's family is strident about making sure her death is not in vain. They're fighting all the way to the top of the health system to ensure that there's change. You're seeing change in Queensland after a damning report last year that said 16 hospitals had high to extreme levels of racism, systemic racism.
But, I mean, it takes, sadly, the death of Aboriginal and Torres Strait Islander people to
and the
make
advocacy of families as well.
Our mob has been advocating and talking about this for generations, but it takes the death of one of our mob to actually start talking about it again. Does that upset you? Does that make you angry?
Well, it makes me angry, and it makes a hell of a lot of other people angry too. And I think the solution is voice. You know, we talk about voice, treaty, truth. We need to tell the truth about what's going on in our systems, and racism and prejudice are part of the truth. And then we need to empower Aboriginal and Torres Strait Islander voices so that they can speak back to the system. When we have that, we might have culturally safe care and people who aren't dying in circumstances like Ms. Day and Naomi Williams.
Just got one last question for you, George. With all the families that you've worked with across multiple cases in this country, what does accountability look like for those families in these systems when they have failed?
Well, they want accountability. That is the one thing they hope from the coronial system. It doesn't always deliver. People want charges laid. People to someone to lose their job when a death is caused by their action or inaction, and sadly, it doesn't happen. It rarely happens, and it rarely happens through the coronial system. So they might get some sense of vindication in that racism is named, but they don't always get that sense of justice or accountability by someone losing their job or being held accountable for that death.
Yeah.
Well, all right, George, thanks. That's all we've got time for. Thanks for joining us.
Thanks for your insight.